All right, so we're here with another edition of the Beyond the Blade podcast, and we have as our guest today Jenry Lopez-Duque from the Renuvion company. That's all about skin tightening, and we're going to get into the specifics of that, but we wanted to welcome Jenry to our podcast. He has been with the Renuvion company for 8 years, if I'm correct.
That's correct, doctor. Thank you so much for having me here today with you.
Thank you. And Jenry and I have been working together for many years. I've had this device since 2019. He reminded me today, and it's been a success story working with Jenry and with Renuvion. We've very much appreciated their support throughout this process. I'm going to open the floor so that Jenry can talk a little bit more about Renuvion, its FDA approval, the pros of using this device, and of course, what it could be possible cons.
Yeah, thank you so much for having me here today. So Renuvion is the only device approved by the FDA for tissue contraction following liposuction. And what that really means is like Renuvion went through an extensive studies with the FDA to get approval. And basically it's proving that it is effective and it is safe. Mm-hmm. And that's how Renuvion came to the market. We were talking about Renuvion J-Plasma, what it is Renuvion, what it is J-Plasma. Mm-hmm. So it's basically the same company, it's just two different names. Yeah. Renuvion is being in the market like literally for more than 10 years as J-Plasma before in the hospitals, treating endometriosis like a minimally invasive laparoscopies. And we just find out that, this thing can contract tissue more than anything else in the market. And what's happened to us like after we came out to the aesthetics market, when you say J-Plasma to a patient, they thought it was PRP. So the company Apex decide to change the name for Renuvion, which is basically two words. You have renew and ion, and they put the two words together just to make sure that it was something that it resonates different to the patients.
Yeah.
So Renuvion, as I say, is a tissue contraction device.
Yep.
It's normally used with a liposuction. Mm-hmm. It could be used without liposuction as well. But in the environment that we are today, you always have some fat to remove, and that's where we come to the picture. So Renuvion is being used in every single OR today in the country, where most of the times you're doing liposuction.
Yeah. That's very impressive. They've had an amazing success story using this technology. I think part of the success is how few and far between, and in my practice, thankfully, no complications have been related to the device, which is very, very hard to say about any technology that uses any sort of heat. So there is a component of heat in the J-Plasma device, but the way in which we create the settings on the machine and the way in which we're trained as physicians by Renuvion to perform these procedures is very much graduated based on the patient's tissue characteristics, the thinness of their skin, the amount of adipose tissue or the fat layers, and also how much definition we're trying to achieve while doing all of these things safely. And so Renuvion has been amazing in terms of the boom in basically higher definition liposuctions, how to create more oblique lines, central lines, and just how to give an overall better physique than we were able to give as surgeons maybe 10 or 15 years ago. So that's where I think also, Renuvion has really taken the torch and moved it forward. Can you talk to us a little bit about the idea of, quicker recovery, coagulation of the tissue?
Yeah. So you have to think about in this way. We are using energy, and every time you use energy, I just kind of put an analogy so you understand what I'm talking about. If you put a piece of steak on the grill, that steak is going to reduce the size time by time because you're basically taking all the water out of the steak. Mm-hmm. So Renuvion is looking for the path of least resistance on those connecting tissues that you have between the muscle and the skin. Mm-hmm. And when the doctors remove the fat, all that you have is that connecting tissue. And Renuvion, it literally targets that connecting tissue and is shrinking that connecting tissue up to 60% more than just regular lipo, which is basically like 10%. Mm-hmm. So you enhance those liposuction results, and you're taking those liposuction results to the next level. And not only you create that contraction, you also create, based on that coagulation as well, you are like literally coagulating all those little bleeding spots. And that what creates is basically less bleeding for you, and your body is gonna go through a neocollagenesis stage, which is basically a recovery process. And that recovery process is gonna be faster because you're creating a control injury under the tissue, and your body is telling the tissue, let's go, get to fix all this rapidly because it needs to be fixed. So with Renuvion, you're not only getting tissue contraction, you also get coagulation, and you also get a much faster recovery than if you were doing only liposuction.
Yeah, so a lot of people just think of J-Plasma Renuvion as skin tightening, but it's a lot more than that, and it's very important to recognize that. In my practice, it's really helped me in terms of postoperative bleeding. So when I do a liposuction and I add Renuvion to it, my bleeding risk really goes down significantly, which is very important, because if you have a lot of bleeding or you have anemia, which is low hemoglobin levels, low red blood cells in your body after surgery, you have a much slower recovery because you're more tired, you're more fatigued, and it takes longer for you to really get back that energy that you had right before the operation. So Renuvion has multiple benefits to it. Can you talk to us about what body parts we can use it for?
Yeah. So Renuvion could be used from head to toe. In all those areas that you're doing liposuction, Renuvion will definitely enhance those liposuction results. So let's talk about like medial face, neck, brow lift, abdomen, flanks, arms, back, inner thighs, outer thighs. So on all those areas that you're gonna be doing liposuction, you should be using Renuvion. And now we have different trends today where it's like the skinny shot, where those patients are losing like a lot of fat. So what's coming after all that loose fat, it's just like laxity. So Renuvion could be also used in those areas that you have laxities that you may not need liposuction. So you can use it with liposuction, or you can use it without liposuction in all those areas from head to toe that it's need for tissue contraction.
Yeah, absolutely. And so, part of the algorithm here is, if you're thinking of using Renuvion, and you're not really sure if you're a great candidate, you want to go to a board-certified physician that has trained with Renuvion on the device. And, based on that, examination, we can give you a better idea of whether or not a surgery is going to be a better option, or Renuvion is going to be a better option with or without liposuction. And I think that that's very, very valuable. And it's now we have something in the market that we can use, that we don't have to rely just on cutting and sewing skin every single time. We can try to give our patients a less invasive approach, but get a very good result.
Exactly. And you have to make sure, just as you say, like make sure that you're using technologies today that they are FDA approved, and the reasons why they are obvious. They go through a extensive amount of improvements to make sure that the device is safe and effective, and make sure that you're using doctors that they are certified by the Renuvion company, because those doctors, they know how the device is supposed to be used. And make sure you're using your surgeon wisely, because it's important that the surgeon has extensive amount of experience like you. You probably have done more than 500 Renuvions. And that's extremely important because, as you say, you have to evaluate the patient just to make sure this is the right treatment for the patient.
Yeah, absolutely. So in summary, we want to give Henry a chance to let everybody know how they can get more information about Renuvion, maybe the social media handles you guys are using and the websites.
Absolutely. So you can follow us on Renuvion South Florida. You also can follow us on Renuvion. It's in IG as well. And every time you go to Google, you type Renuvion J-Plasma, you will be able to find a lot of information about.
Yes, beautiful. Well, thank you so much, Henry, again, for being on the podcast. We really appreciate your time being here, and it's been a great experience. We hope to have you back again.
Yeah, absolutely. Thank you again for your time. And give me the words. Like, we're going to do it in English. So before we finish, Doctor, we just wanted to congratulate you for being one of our top Renuvion users in the South Florida territory. So thanks so much for all your efforts and all your support to the company.
Thank you. We really appreciate it. This is an amazing honor. There are many plastic surgeons here in Miami, but I'm very, very happy to partner with Renuvion and be one of your top physicians. I really have enjoyed using the device, and I hope to keep working with you.
Absolutely.
Thank you.
All right.